be with you this afternoon. A subject which I think everybody should know and should know more about it, because this is something which is not trivial. This is about a condition which we think or pass off as a common cold, but can have a significant impact and even leading to death. So I think this is something all of us, not only here, should understand, but this knowledge should spread to the public also. The flu is a virus which has been with us for several centuries. I think all of you would have heard about the 1918 flu pandemic. When the COVID came in, we all was mentioning about the 1918 Spanish flu, which was a pandemic all over the world. And it is believed that the number of people who died because of the Spanish flu is actually more than the number of people who lost their lives in both World War I and World War II put together. And because this affected a lot of young people, there was a phenomenal strain on the society, and it is believed that for several years, up to a decade after the pandemic, it still had impact on schooling, on jobs, on the health effects which it had caused on people. So that is one spectrum of the flu. That was a very serious pandemic. But we still have the flu. Every year it affects millions of people. It is believed at least 5 million people suffer with flu every year, and probably many more who may have a subclinical infection. The flu typically causes a sudden onset of body pain, a little bit of a runny nose, cold-like symptoms, scratchy throat, and this is followed by fever, quite often 101, 102 with a lot of pain. Patient is really poorly for 2-3 days. Then the fever improves and settles, but the person may be left with a very bad cough and tiredness, which may persist for several days and sometimes even weeks. So this is how a typical flu presents. Now this has to be differentiated from the cold. The cold typically causes a runny nose, a stuffy nose, a little heavy head. You feel feverish. Temperature rarely crosses 99.5. So the presence of a significant fever and severe body pain is the main factor which distinguishes a flu from a common cold. Common cold is usually trivial. You are down for a couple of days and then you are back to normal, whereas the flu can even kill. Anybody can get the flu, but if flu affects young children, less than 5 years, if it affects people over the age of 65, or people with other what we call as comorbidities, people with diabetes, hypertension, heart disease, lung disease, kidney disease, this can cause a severe pneumonia, just like the COVID. When you get a pneumonia, it can lead to hospitalization, ICU care, ventilation, and even death. So young children, elderly people, people with comorbidities can have complicated flu pneumonia, which can even lead to death. So when we read in the papers, 2 people die of flu, it can happen. It is not unusual. It is only the fact that we are picking it up better now, and this is the reason I think everybody should be careful how you treat the flu, how you react to the flu, and what you do to prevent yourself from the flu. Do I stop here?
And if infected, it can lead to complications and hospitalization. What I'd like to share with you is about what is the evidence suggesting about influenza and its implication. It really shows that if I take a high-risk population, which doctor just defined, that typically elderly patients more than 65 years of age, patients with comorbid conditions. Can you stand?
Yes, of course.
I can see everyone. So patients with comorbid conditions like diabetes, cardiovascular diseases, chronic kidney disease, pulmonary disease like asthma and COPD, if these patients are vaccinated with influenza vaccine, there's a 50% less chance of hospitalization if they are infected with influenza. So that is a protection what a vaccine can offer to this high-risk population. Now coming to children less than 5 years, we always advocate that children less than 5 years should be taken influenza vaccine. It has been seen that if these children are vaccinated, there's a 57% reduction in the risk of hospitalization if they are infected with influenza. Now most importantly, for a pregnant woman, if they are vaccinated, there's less likely, almost 20 to 30% less risk of a preterm birth in the pregnant woman. So these are the patients who falls in the high risk category and need to take a vaccination. So we do understand that in a patient with influenza, if they are vaccinated, it prevents all the complication. But still, there are a lot of barriers as to why vaccination is still a challenge out there in India. First and foremost, the most important barrier is that influenza or flu, as Dr. rightly pointed out, is still being perceived as a minor self-limiting disease. The patient would get the disease on one day and a point of time it will just go away. But please note, influenza is caused by different strain of viruses. It is the H3N2 or the H1N1. Globally or in India, it is a major public health concern because in these patients who get influenza, if they're not well protected, they can lead into complications, they can end up with hospitalization. The second important barrier when it comes to influenza vaccine is that there is a lack or less knowledge or awareness about this particular disease or the role of vaccination amongst the doctors. We have a doctor who takes an annual vaccination, but believe me, there's a lack of awareness amongst the doctors as well as the public. So due to which the importance of taking a vaccination becomes a little self-limited. And especially in the high-risk population, we spoke about elderly patients, patients with diabetes, cardiovascular, renal disease. The focus out there is more towards treatment rather than prevention. And herein, it is very important that these patients understand that vaccination would actually help them to prevent the complications of influenza. The third most important factor is vaccine hesitancy. Now, if you look at this word, vaccine hesitancy, globally, this is supposed to be the 10th most important threat to the global healthcare as defined by the World Health Organization. And what is vaccine hesitancy? There's a concern over the safety of the vaccine. There's a lack of trust. There's a cultural issue due to which patients do not take a vaccine. So these being the barriers about vaccination, our objective for today is to spread awareness about influenza as a disease. It is not a common cold clearly been told by the doctor. There is a preventive measure, that is vaccination. Get vaccinated, you can prevent the complications or hospitalization. And the age-old wisdom what we all have in our doctor community or amongst the people, that prevention is always better than cure.